We are not absolutely sure what the role is that allergy plays in chronic rhinosinusitis. We know that patients with chronic rhinosinusitis have influence of their allergies on the severity of their disease, but it's not so clear whether patients with chronic rhinosinusitis have more often allergies than the general population. Of course, we know that allergic sensitization is very common in the population. It's around 30 to 40%. And it's about the same in patients with chronic rhinosinusitis. So we're not absolutely sure how important the role of allergy in chronic rhinosinusitis is. And probably it also depends on which form of chronic rhinosinusitis patients have. So it might be that allergy is more important in chronic rhinosinusitis without polyps than in sinusitis with polyps.
I believe it, but proving it is very difficult. So part of the problem, so there are actually controversial studies on this particular issue. Part of the reason I think the studies have not proven it at this point in time is because of temporal issues. So a typical history of a patient that develops chronic rhinosinusitis had allergies in childhood. Then later, they develop what they think are allergies, again, following an upper respiratory tract infection, often go back to the allergist, and now they find that they're probably only sensitive to molds and dust. And so the linkage is not as clear, and it turns out to be chronic rhinosinusitis. So the answer is, it's probably not all IgE-mediated allergy, but clearly reactions to the environment are a major factor in this.
There are so many things that we don't know, but what we do know is that many patients with CRS do have allergies. So whether or not there's a pathophysiological mechanism there, we don't know. We know that it's a common type of inflammation. We know that in chronic rhinosinusitis, with nasal polyps, for instance, there is actually a local production of IgE bodies towards Staphylococcus antigen. So in that sense, I would say that it's a risk factor, but we don't know the mechanism. We do know that many patients with allergy have chronic rhinosinusitis. It's not a precise answer, but there's not really a precise, scientific answer to that question.